1.61 is our approach to non-surgical facelift, to give you the perfect go-to ratio of 1.61, whether it's in your face, in your neck, or we can also tighten other areas in terms of skin laxity on your body as well. In terms of facial aging, what we need to understand is as the bone resorbs, anything sitting on top of the skull or the bone slides down. So that means fat pads migrate. Your malafat pad moves down, your buccal fat pad moves forward, and everything looks not as defined as we want it to be. If we're kind of like we don't want to do contouring work anymore, we don't want to do filler work anymore, and we want to reposition the fat pads, then the best approach is surgical threads, not non-surgical threads. And when I mention non-surgical threads, I mean not PDOs, not gold threads, not Korean threads, not things that are put in superficially in the dermis and then they last for a few weeks and suddenly your face and neck drops again. No, what we want to do is we want to use surgical threads to reposition the fat pad. So if we think about it, if we cut ourselves and we go to the hospital and they re-suture us up, and then we turn around and this re-anastomoses. So in the same way, if we turn around and suture up the fat pads with a surgical thread, then what happens is that thread dissolves and you get your own collagen causing a string pulling up that fat pad and positioning it properly. And what you want to notice is that the results of the surgical thread will last for a few years. And most patients are normally worried. They turn around and say, oh, but will it fall down like non-surgical thread or PDO thread? No, because what you have is it slows down the rate of aging, or it slows down the rate of fat pad migration. And you've got to be quite careful because you want to make sure the vector of pull is correct. So if your fat pad is here, we want to reposition this fat pad up here. You've got a submental pouch, we want to bring it and stretch it back. So a non-surgical thread is not something that's viable or doesn't last, but a surgical thread does last a few years and it does work on the right anatomical plane. However, it does take a few hours. It is a painful procedure. We do knock you out and you don't like me afterwards. And in terms of strength of pull, you'll get indentation or dimpling, and this can take a few weeks to recover from. Now I need to pull because what's the point of doing the procedure if we can't lift the fat pad up in the correct position, number one. So what you'll notice in the next 4 to 6 weeks, so initially after the procedure, your face will be tightened or your submental pouch will be tightened or wherever we're tightening on your body will be tightened. And then we'll see these holes or dimplings. And initially we're, oh my God, I look lifted, and then it will suddenly drop a little bit. And then as the collagenesis takes place, because we're coming into the fat pad, we're going to hypodermis and the fat pad, we're not in the dermal area, what will happen is that the dimpling will soften with time. It normally takes 4 to 8 weeks for skin to resolve itself. So you have to be patient, but the harder I pull and the stronger the dimpling, the longer lasting the effects. It is quite an invasive procedure, so I always say, if you're not ready for it, then do micro contouring on the bone, because that will give you 80%, surgical thread lifts will give you 90%, and face lifts and neck lifts will give you 100% skin tightening. And you can combine micro contouring with, in terms of strictest machine-based tightening, that gives you 50-60%, and the cover of the skin you can tighten with facialis and ego. So you've got to be really ready for this, but once you've done threads, you're not going to be contouring much. So here's the other thing. Once I've lateralized you and lifted you here and defined you and managed the submental pouch and tightened your neck, the only areas you tend to need contouring is where you get volume loss. So in the infraorbital area, around the oral area and the corners of the mouth. These tend to still age regardless of facelift or surgical approach or threads. So it's still the same outcome. And yes, I've had them done. Oh, here's the other thing, that Bella Hadid brow, or if you're not ready for the ponytail lift or the lateral canthoplasty or the acroblepharoplasty, you can actually use threads to lift and lateralize your, you can see it doesn't suit me, but you can actually use threads to actually give you that cat eye. Yay!